So one of the misconceptions that I wanted to go over in our industry, one of the things that I run into sometimes with patients with pretty severe injuries is the fact that with the advances in technology just across the medical field, that every injury is, I would say, fixable, or there's an excellent answer or treatment for every single thing. And so I think that even in my career, there are things that maybe at the beginning were not as fixable or didn't have as great results, and definitely things have improved. And across the board, of course, this is true that there's so many things that we treat that are, at one point were really not treatable, and now they are treatable. But something, for example, let's say a severe elbow fracture. We have fancier plates and screws. We have joint stabilizers, dynamic internal fixers, things which allow us to provide stability to really shattered elbows and things of that nature. I'm using this as an example because all these things are not exactly the same. I mean, you can have a bad elbow fracture that's two big pieces or three big pieces, and you can have a bad elbow fracture where literally everything is just shattered to pieces, and there's really not much to work with. And so in those cases, those extreme cases, there really is not a lot that we can do in terms of reconstruction because the materials and the things that we use, and we need to have some structure left to reconstruct. And of course, there is the option of a total elbow replacement, but even then, the outcomes are somewhat limited when it comes to getting someone back to exactly what normal would be. So I think the biggest misconception being that for every fracture or injury of this nature, these trauma injuries, that there's, because of the advances in technology, that there are these new fancy treatments for everything. And the simple fact is, for most things, I would say yes, definitely there have been significant advances, but there are still those injuries which are severe enough to where they're just not really reconstructible. And just realizing that and knowing that, the different nuances of repair, all of these injuries are not the same, and just realize that we have to take them one by one, and getting the expectation as to whether or not it's fixable or not is definitely a discussion to have with your surgeon.